Now, moving on to our next presentation by Javiera Cornejo Kelly from University of Chile, presenting on the title Antimicrobial Residues Detection in Faces of Proactive Animals by Microbiological Screening. Doctor, the stage is yours now.
Thank you very much. I will share my screen. Okay. Thank you very much for the invitation. My presentation is, as you said, antimicrobial residues detection in feces of productive animals by microbiological screening. My name is Javiera Cornejo, and I work in the Faculty of Veterinary Science of the University of Chile, and I'm the head of the Laboratory of Food Safety. And this work is financed by the ANID, that is the National Agency of Research of Chile. So first of all, the framework of this research is that nowadays one of the main concerns of the modern livestock veterinary practice is to increase and to improve animal production in order to satisfy, of course, a growing global demand of animal protein. But in addition to this food security concern, food safety have also become a major issue in animal production. So these qualities, both food security and food safety, strongly depends of the ability that we have to raise healthy animals. And for this, for ensure livestock health, we sometimes requires the use of antimicrobial agents to treat sick animals in case of the presence of infectious disease. So antimicrobials still have a very important therapeutic role within the veterinary science. So as we can see here, according to the OIE, this is the quantity of antimicrobials that are used by the different countries in the last years. And you can see the most used antimicrobials in veterinary science. Among them, we can find the tetracyclines, quinolones, penicillins, macrolides, and so on. So millions of tons are used in treatment, metaphylaxis, and still in some countries for prophylactic and growth promoter use of this antimicrobial. So we know that these drug residues may persist in edible tissues, and of course they can cause adverse effects as direct toxicity, allergic reactions, mutagenesis, and among others. But we have also seen our research group and some other research groups recently that drug residues may persist also in non-edible tissues. And we have done a lot of research in this, mainly in feathers and also in other non-edible tissues as cloth. And we have seen that different families of antimicrobial may persist in high concentrations in these non-edible tissues in comparison with edible tissues. So also another very interesting subproduct of this animal production is the manure, mainly poultry droppings and poultry litter. And we have seen, it has been described that antimicrobials are excreted in very high concentrations in poultry, in animal manure. And there is some literature about this. And this came to our attention because this can become a problem not only for public health, also for environmental health, because they are released to the environment. They're also maybe used as fertilizer, and they're still used as an ingredient in the diet of other animals. So these high concentrations that have been seen in manure of productive animals, litter, and these byproducts can become a problem re-entering the food chain. So also it has been studied that manure in antimicrobials in manure can be very persistent during time. As you can see here, this is a study performed by the Wageningen Institute. It can, depending on the antimicrobial family, it can persist for a very, very long time. The most persistent antimicrobials are the most used antimicrobials in veterinary medicine. So with this evidence, we can see that livestock manure can be considered a very important route that allow the spillover of antimicrobials to the environment. And of course, as we stated before, this can become a risk of re-entering of this antimicrobial to the food chain. So on the basis of this information, we may expect that the analysis of antibiotics in animal waste can be an effective matrix to detect, of course, these high concentrations of antimicrobial, and it can become a valuable tool for monitoring, for example, the trends of use of antimicrobials in farms, and becoming a non-invasive method, at the difference of using edible tissues. We have done some work on this. For example, we made a depletion study studying 5 antimicrobial families in treated broiler chickens, where we saw that the concentration treated by the chickens was very high after treatment for a very long time. As you can see, 30 days before treatment, chickens still spilling antimicrobials from different families in the feces. And also, we have detected high concentrations of antimicrobial in poultry litter, and also we have detected cross-contamination between treated and not treated pens. So based in this information is we decide to put on this new technique, this screening method, because to the date we have only worked with a method based on mass spectrometry coupled with liquid chromatography that to the date has been described for the detection of these chemical contaminants to be very sensitive, selective, and allowed the quantification of very small trace levels of these antimicrobials. But we all know that these methods are very expensive and very difficult to perform. So we decide, or we try to put on screening method that will allow the detection of these antimicrobials with a method that is also efficient, but low cost and high performance. So this rapid screening method is can become an alternative for the use at animal production level, and with a low cost, fast, effective, and no requirement of a complex sample treatment. So our solution is focused on the development of a new analysis methodology using these non-invasive metrics, and our method can detect six families of antimicrobial residues in productive animals, and our main focus is to have a tool that can become early detection, because we don't have to wait until the time of slaughter to perform it. So the implementation of this type of assay in feces of livestock have not been described until today. So this is the experiment flow. In the first stage, we implement the screening method, test for the detection of six families of antibiotics in family in an in vitro assay. And afterwards, we confirm the performance of our assay in an in vivo analysis in experimental animals. And now what we are working on is in the confirmation on field analysis. So we developed this method that with a quick extraction of antimicrobial residues belonging to the families of tetracyclines, beta-lactams, sulfonamides, macrolides, lincosamides, and quinolones from the fecal matrix from chickens mainly. And we select one family, one representative antibiotic from each antimicrobial family. And we establish a cut point according to the MRL of each antimicrobial. Afterwards, we validate this screening methodology in the in vitro study, and we perform the validation according to the recommendations of the European Union, the Commission Decision 657, and we assess all the parameters, the detection capability, specificity, applicability, and richness. And all the parameters show to be satisfactory for all the antimicrobials that we tested. Afterwards, we made a verification in vivo of the microbiological screening methods. And so we prove it in experimental treated animals. So we treat 6 experimental groups with one of each of the antimicrobial used. We treated them therapeutically. And of course, we use the EMEA guidelines, and we use 6 animals in each experimental group, so we can obtain valid results as stated in the EMEA guidelines. So as you can see, we treat therapeutically, as it was stated for each commercial formulation. The chickens, we take the samples, we treat it with a therapeutically dose, and we took fecal samples after the treatment. And these samples from each experimental group were tested with the screening method with the 6 plates for the detection of the presence of one of each families. We test the presence of enrofloxacin plus the ciprofloxacin metabolites, erythromycin, lincomycin, oxytetracycline with the epimber, and sulfachloropyridazine. And also, we afterwards we first test in the screening method we have implemented, and afterwards we confirm these samples, the screening positive samples, by a multi-residual analytical method that we have previously implemented and validated in the previous published work that I showed you by LCMSMS. So this was the verified and quantified concentrations were greater or equal to the detection capability of the microbiological screen method. The results were considered concordant when the concentration obtained was greater or equal to the detection capability of the screening method. So as you can see here, for the detection of all the antimicrobials, we have very clear inhibition halos. Here you have one picture of the blank sample and one picture of the sample of treated animal. And for all the antibiotics, we have very clear results, except in the case of sulfachloropiridazine, that we have partial inhibition halo, but this was something that we were expecting because it has been described also for sulfonamides for other matrices. So afterwards, as I told you, these samples were confirmed and quantified by the confirmatory technique by LC-MSMS, and positive samples and one blank sample from the control group were verified, and residues were quantified, and all the concentrations were above the detection capability of the microbiological screen methodology. So we can set that this way we confirm that our screening method is valid to detect antimicrobials of these families over the detection capability that we have set. So this verification process by in vivo of our implemented methodology have demonstrated that the 6-plate microbiological screening method is capable of detect antimicrobials of the families that we have selected, tetracyclines, beta-lactam, macrolides, quinolones, sulfonamides, and lincosamide in broiler droppings matrix after the metabolization process. This method is, we can say that is a tool that is competent for the monitoring of antimicrobials in animal production, since it can allow the simultaneous determination of these 6 families of antibiotics using a non-invasive matrix, and which can be considered also an environmental matrix. And it is a very easy and cost-effective matrix for the detection of antimicrobial residues. Now, we are working also with the field samples. That was the last stage of the project, and we have taken already samples from pigs, poultry, and turkey, and we have had also results that we have had verified our method from treated animals, becoming from the industry, and we are working with that results now. So I hope that we can show you that in the next time, because we have had very interesting results too. So that's it, and thank you very much for the invitation.
Thank you for that insightful talk, Doctor. Now the stage is open for questions. I assume that you have no questions from the speakers, Doctor. Once again, I thank you for being a part of this webinar and hope to associate with you in our future events in person. Have a great day,
Very
Doctor.
much.
Thank you so much.
Thank you very much.
Now, moving